Let me say a pleasant good evening to Caroni East MP and UNC Shadow Minister of Health, Dr. Richard Sicharan. Good evening, sir.
Good evening, Mikee K, and good evening, everyone.
Yes, thank you so much. Earlier today in the Senate, you had the Minister of Health praising doctors and healthcare workers and nurses. He was at the time responding to a question that was posed by the opposition Senator Wade Mark on whether the Pan American Health Organization investigation into the deaths of several babies at the Port of Spain General Hospital will include the latest case that surfaced this week. Dr. Citran, the first thing that people were looking at when all of these things were happening was that, listen, we just came out of a pandemic where hygiene, where social distancing, where sanitizing was a priority, everything centered around that. And to hear now that in the wards where babies are going to, be able to be attended to, there seemed to be a bacteria problem. I mean, what happened exactly?
In this case, Mikee K, from what we've learned, that the neonatal ward in the Port of Spain General Hospital was infiltrated by as much as 3 different types of bacteria, all of which were very deadly to these very newborn babies. And this is a very, very serious and a clinical breach of the care of these patients who are babies at our public healthcare service. Now, these neonatal babies, they have a very, very reduced immune system, and any type of bacteria or any type of virus could drastically affect their livelihood of a successful outcome in terms of survival. So that's why when you see these babies in these what we call NICU or neonatal intensive care units, they're usually in an incubator, a very enclosed structure where oxygen is pumped into them, and they breathe a very sterile environment. So to say that 7 babies, at least 7 babies in the initial count, have perished or passed because of this bacteria is a very, very drastic breach of clinical protocol. And we are awaiting the outcome of the POSGH investigation, because what has happened here is something called cross-infection, whereby the bacteria possibly infiltrated one baby and it was spread to all the babies at the time in the neonatal intensive care unit. Now, how could this happen? And it possibly, as we have been saying over a number of occasions, it's due to the lack of human resources, in this case at the neonatal ward in Port of Spain General Hospital. The average, the WHO standard is 1 neonatal intensive care nurse per baby. And we don't know if this was adhered to by the Port of Spain General Hospital. Because if one nurse was looking after 7 babies, that one nurse could transfer the bacteria to each of the 7 babies. I'm not saying that is what happened, but this is a possible cause. And the cause of that is due to the lack of human resources. So if you had 7 babies at the NICU at that time, you're supposed to have 7 neonatal intensive care nurses looking after
and Dr. Citran, that is a very valid point, very critical point, and I'm glad you raised that, because the language coming from the Minister of Health is not the kind of language one would expect when he's talking about, to give clarity to the issue. He said, whilst we focus on those who have passed, and we must, I want to thank healthcare workers, doctors, nurses. Listen, we have no problems with the hardworking doctors and nurses. We simply want to know if it is that the proper procedure was followed. And as you just mentioned, we just want to know if it is that there would have been a problem because you have one nurse working perhaps 18 hours, 17 hours with no rest because there's no one to come and take over her shift, or perhaps the people are not best qualified. We have no issue with the hard-working medical personnel. The problem we have is that there's something wrong in these neonatal wards, and we need to ensure that it is never repeated.
Well, Mikee K, one of the newspaper reports reported that a parent said that when they arrived to see the last moments of their child, the nurse that was attending to their child at the time did not have on gloves. Now, Mikee K, if you have one nurse that has to feed 7 babies, that has to change 7 babies, and that one nurse is not changing, it does not have on gloves, and we don't know if that nurse is washing her hands in between looking after these newborns, that is a possible reason, a possible spread of the bacteria to all 7 babies. Now, that is something that POSGH has to investigate, the lack of human resources. POSGH has to investigate possibly the lack of PPE to these nurses. And POSGH also has to investigate, did we have the sufficient antibiotics to treat with these various bacteria that may have killed these babies. So the drugs are issue as well. Did we have broad spectrum antibiotics, or did we have the more advanced antibiotics that are specifically designed for some bacteria that may be in some cases immune to certain antibiotics? So these are all issues that POSGH would have to investigate, and I'm looking forward to this report and the conclusion of this report before I make any definitive pronouncements on what happened at the NICU at that time.
Yeah, and again, you're right. And we really and truly hope that this investigation is not one, according to Senator Wade Mark, where it is you're just going to draw the line and say this is as far as we're going to deal with the situation. We want to know. I mean, as a Minister of Health, it would have been, listen, I want you to go back, go back to some months and see how long this thing has been happening. We need some data. We need to know how many babies. We're not just dealing with it now. We're dealing with this as far as this is a crisis, a medical crisis. And we want to make sure that it's never repeated. Now, to come and talk about, we love the healthcare workers. And listen, we passed that stage. We want to make sure that the right thing is going to be done moving forward.
Yeah, and Mikee K, the Minister of Health's job is to provide, resources in terms of equipment and drugs to these healthcare workers. And in addition, once a unit or a ward is understaffed, that in some cases leads to cross-infection, because you have this one nurse or a couple nurses attending to all these patients, and they in turn could be a source of the cross-infection. So these are all things that have to be investigated, as well as, as I said before, I would like to know the type of drugs, the type of antibiotics that these babies would have received post-infection, with these WHO protocol drugs to fight the types of infection that these babies may have acquired. So the Minister of Health has a lot to answer. In my personal view, as well as the political leaders, he has to resign. It is too much. It has gone too far now. How many more must die? The Prime Minister, speaking about crime a couple of days ago, said, it could have been worse when he was speaking about statistics and the symposium on crime as a public health issue. And, we don't want to hear it could have been worse. We want to know how it could have been better. And that is the issue we face right now in all ministries under the People's National Movement. Everything is failing. Every single thing is failing. There are no benchmarks for performance for any minister. Basically, if Minister Gayelle could survive this, anyone and any minister can do anything, and they are untouchable.
And you're right. Because
after 7 babies have died in mysterious circumstances, how can he still be the Minister of Health? How can he still be the Minister of Health? So, we have to make sure this never happens again. This has been a stain on the medical history and the medical reputation of Trinidad and Tobago. It has been a stain on CARICOM, because this is something that has not happened recently in any CARICOM nation. And, it has put us at the back of the line in terms of healthcare. When you do research online, you see that this hasn't happened in many countries in many years, and very, very poor countries this has happened in, such as some countries in the Middle East and so forth. So for the amount of money that Trinidad and Tobago spends on our healthcare infrastructure, This should not have happened, and it cannot happen again. These babies do not get a chance to live. These parents have lost their loved ones. I read a newspaper article that said the boiler is down at the Port of Spain General Hospital, and that is what they use to sanitize many of the instruments that, they use to perform procedures. As you know, when you use a surgical instrument, you don't just go and throw it away. It has to be sanitized so it can be used over and over on many other patients.
Exactly.
And if the boiler is down, and you are having difficulties sanitizing equipment and instruments, and you have to transport the instrument to another hospital to get sanitized and then bring it back up, that process, the instruments could possibly become contaminated, So these are all issues that POSGH has to investigate, Ideally, we should have had, the government should have allowed more persons on that investigative team, probably a representative from Trinidad and Tobago as well, an expert representative, and the opposition has asked for that. But whatever POSGH concludes, I'm willing to look at it with an open eye. But this should never ever have happened again.
Yeah,
it should not.
But Dr. Citran, with all due respect, people have been weighing in on this, but not understanding the seriousness of grasping the seriousness of this. Understand something here. There's a war being fought in the Ukraine. There's a war being fought in Gaza. And if you look at the time period that these babies died here in Trinidad and Tobago, less would have died in those war zones that are currently active. So
that is how bad we are, Mikee K, and that is, that is what I've been saying. Dr. Bodo and myself have been preaching for all these years now. Minister Gayelle is ill-equipped to run this ministry. He has no idea what should be the priorities, and the healthcare workers are suffering. I am fully on the side of all healthcare workers. I myself, being a healthcare worker, my 3 younger brothers are doctors that work in the public healthcare system in Trinidad and Tobago. And, these healthcare workers, they work so very hard, they study so very hard, but if they are not given resources, if they are not given the correct equipment, the correct drugs, if they are not given PPE, if they are not given sanitizing solutions to disinfect the areas where they work, if they don't have the boiler working to disinfect surgical equipment, if it's one nurse to 7 or 10 babies in a NICU or one doctor to 30 patients, how can those patients achieve any sort of adequate health care? And that is what we are saying. The priorities are mismatched. They are building these hospitals all for show, and there are not enough doctors, there are not enough nurses, there are not enough equipment, there are definitely not enough drugs to support these facilities. And what we are having is a fall in the level of healthcare in Trinidad and Tobago. And Minister Gayelle and the Prime Minister has to address these issues now. This cannot only happen in the NICU. This can happen in the intensive care unit as well. We have many adult persons that are immunocompromised, be it renal failure, be it they have a cancer, they may be HIV positive, or some other issue. The bacteria can infiltrate those wards as well. And that would be a serious issue as well in any ICU, not only in the neonatal ICU. So this is something that has to be investigated. It has to be prevented. And Minister Gayelle is not the man to do the job.
I agree with you. I want to thank you so much for taking time out this evening to link with us. Very insightful, wonderful conversation. Best of luck to you and your entire team, and we will be following this story because really and truly, I always remember the words of my grandmother. Children don't ask to come here, and they certainly don't ask to come here and suffer. I mean, these are babies, helpless babies. Thank you so much. Thank you so much, Dr. Citran.
Thank you, Mikee K. Thank you.